Thanks for coming in. Listen, before I get started with your cleaning, I want to let you know that Dr. Brown has asked me to include some screenings in your cleaning for you today. And the reason that we're doing that is that recently there's been a lot of very compelling evidence that says that the mouth and the body are connected. Perhaps you've heard some of that or seen it on television?
Yes, I have.
Have you?
In the paper.
You know, it's actually been in the paper. It's been in actually papers all around the country, in Newsweek, Women's Day. Some people have caught it on 60 Minutes, but there is a relationship between the mouth and the body. And so because that's pretty compelling at this point, what we're doing is we're incorporating some additional screenings. They're actually included in your visit today. I want to let you know what those screenings are. The first thing I'm going to do today is take your blood pressure. This is a blood pressure screening. We want to make sure that you're within the normal range. The American Medical Association has changed those guidelines, so I'm going to be doing that for you today. In addition to that, I'm going to be reviewing your health history with you, and I'm going to ask you some family history questions. A lot of people don't realize that their family history plays a big part in what's going on in their bodies today, and it also can have a reflection of your dental health. I'm also going to be doing an external head and neck exam for you, where I'll be checking the lymph nodes on the outside of your head and neck, and I'm going to walk you through all of those steps as we go. We rarely find any problems, so I don't want you to be concerned about that, but I will narrate as I go so you know exactly what I'm doing and why I'm doing that. Next, once we go in the mouth, I'll do the internal cancer screening. That's the part where you stick your tongue out. You know, we've done that before. Right. And I'll also be doing a video tour so that you're able to see all of your teeth up close and personal on our monitor, and you'll be able to see exactly what I see when we look inside your mouth. And I'm going to be checking to make sure that all of your existing dentistry looks good and is serving you well. And then finally, I'll do a periodontal screening, and you're going to be familiar with this part. This is where we call out those numbers. And you'll remember that a normal reading is 1 to 3 and that healthy gums don't bleed. And once again, I'm doing these screenings at Dr. Brown's request because the mouth and the body are so closely connected. We want to make sure our patients are really healthy.